Have you been feeling constantly fatigue with dry eyes and dry mouth? If so, you could be suffering from Sjögren's disease, which is a chronic autoimmune disease. In this video, I will discuss about 10 most common signs and symptoms that you should carefully watch and discover if this might be the cause of your symptoms, because it is not all in your head. Let's begin.
Rheumatologistoncall.com.
Sjögren syndrome is one of the most complex autoimmune diseases that many doctors have difficulties to recognize because patients usually present with a multitude of complaints that are not always related. Unfortunately, it may take years and many visits to the doctors for patients with Sjögren disease to receive a diagnosis. Now let me tell you the story of one of my patients. Maria is a 48 years old woman. She's highly respected in her community. She has 2 kids and a high responsibility job. And she was always sharp and active lady. But when she turned 45, she started to feel very fatigued. She noticed that she was having brain fog. She was difficulty to find her words, and that was not herself. She went to see her primary care physician that told her maybe she's too stressed and maybe she needs more rest. In a matter of a few months, she noticed that she started to have tingling and numbness in her legs and sensitivity to the skin that was very high. With light touch or a hug, she was not feeling pleasure, she was feeling more pain. Again, she went to the PCP and she received some vitamin B12 supplementation, but her symptoms did not improve, and in a few months she was again seen by her PCP and she received a referral to a neurologist. After a few visits in the neurologist office, Maria returned to her primary care physician with a diagnosis of fibromyalgia. Her PCP recommended her to take an antidepressant and send her back home. But in a few months, she started to have severe dryness in her eyes, in her mouth. Her skin was very dry, and also she started to have severe vaginal dryness. And nothing that she tried was helpful. She thought initially this is menopause, but then when she looked online, she found one of my videos on YouTube that was discussing an autoimmune disease, and then she reached out to me for more help. For those of you that do not know me, I'm Dr. Girnita, a board-certified rheumatologist and the founder of Rheumatologist on Call. Like Maria, many patients will be seen by many specialists or will be seen many years and receive many diagnoses until they get to the right one. Now in this video, I will go over briefly the 10 signs of Sjögren's disease that you should pay attention to. Yes, now Sjögren syndrome is called Sjögren disease. As we understood, there is no longer a bunch of symptoms under one umbrella. It is actually a complex disease. Number 1 sign is dryness. Dryness of the eyes, mouth, skin, and vaginal dryness. Patients describe eye dryness as itching, irritation, sometimes blurred vision due to decreased tear production. Dryness of the mouth can also be bothersome. Patients carry a bottle of water all the time. They wake up multiple times a night because they feel thirsty. But the dryness of the mouth can also lead to difficulty swallowing, taste changes, frequent cavities, and salivary gland inflammation. Some patients will develop salivary gland swelling called parotiditis that can be very painful. The skin is dry and crack easily. You may also experience itching. Many females are complaining of vaginal dryness, irritation, pain with sexual intercourse, and itchiness, which can dramatically affect their sex life. Number 2 is muscle pain and joint pain. These signs are very common, often symmetric but without visible swelling. It may look like rheumatoid arthritis, but is not rheumatoid arthritis. The hands, the wrists, the knees are frequently affected, and the difference between Sjögren disease and rheumatoid arthritis is that Sjögren will not deform the joints. About 40% of patients with Sjögren disease can also have rheumatoid factor test positive, especially in patients with joint pain, and more rarely positive anti-CCP antibodies, which are also seen in patients with rheumatoid arthritis. And we believe that these patients that have these antibodies have more aggressive disease and they may develop erosions in their joints. Number 3 is lung disease. Up to 20% of Sjögren's patients experience lung issues like dry cough, shortness of breath, and even interstitial lung disease. Sometimes lung symptoms appear before dryness. Patients can develop upper respiratory infections like sinusitis and present with a dry, irritating cough. The cough could be due to severe dryness of the airways or because of reflux that comes from the stomach. And sometimes patients can see changes in their voice or hoarseness. In some cases, along with the dry cough, patients will present to the doctor because of severe shortness of breath that we call dyspnea. The shortness of breath can initially affect you after walking a short distance, going up a flight of stairs, or even at resting. The test that we usually do to evaluate the lungs is called pulmonary function test or a high-resolution CAT scan that can identify lung fibrosis or interstitial lung disease. Number 4, neurological signs. From headaches and tingling to more complicated situations like transverse myelitis or optic neuritis, Sjögren's can impact the nervous system in many ways. Sometimes patients can even present with symptoms that look like multiple sclerosis, and very rarely patients with Sjögren can present with brain inflammation that we call encephalitis. I have multiple videos and talks specifically talking about neurological complaints, so please watch this and learn more. Number 5 is heart disease. Yes, Sjögren can affect your heart. The chronic ongoing inflammation can increase your cardiovascular risk. What does it mean? It means that you may develop heart attacks, fluid around the heart, arrhythmias like heart blocks, and even strokes, high blood pressure, and even thrombosis. Number 6, gastrointestinal problems. Patients with Sjögren can have difficulties to swallow food because they have decreased saliva, and they can develop nausea, abdominal pain, and gastritis or constipation, and even diarrhea. Liver function changes, primary biliary cirrhosis, or autoimmune hepatitis can also be seen in patients with Sjögren. Celiac disease is also seen more frequent in patients with Sjögren. Number 7, kidney dysfunction. Bladder dysfunction, interstitial nephritis, and kidney dysfunction leading to acidosis are also seen in patients that are suffering from Sjögren disease. Patients can develop an increased frequency in urination, and they may have to urinate at night, affecting their sleep. These symptoms can be confusing, as patients may think that they have a urinary tract infection, but the urinary test does not show that. Number 8, depression, fatigue, and fibromyalgia. Fatigue is a debilitating symptom, and many patients with Sjögren disease complain about disabling tiredness. Fatigue is also associated with poor memory, poor concentration, brain fog sensation, and in time, these ongoing symptoms can lead to depression and anxiety, and many patients will be labeled as having fibromyalgia. Number 9, blood disorders like anemia, low white blood cells, high immunoglobulins, and cryoglobulinemia may develop in patients with Sjögren. Anemia is most likely induced by the chronic inflammation, but it may have other causes, so it is crucial to have a complete evaluation done by your rheumatologist. The white blood cells count can be low, but most times does not increase the risk of developing infections. Elevated levels of immunoglobulins are seen in about 60% of patients. In these patients, we also see positive rheumatoid factor and positive SSA and SSB antibodies. These patients with high levels of immunoglobulins need to be carefully evaluated because they can be at increased risk to develop multiple myeloma, or lymphomas, and these two are types of blood cancers. Number 10, lymphoma. Compared to the general population, patients with Sjögren's syndrome have an increased risk of non-Hodgkin lymphoma. The prevalence of lymphoma increases with time. For example, following the diagnosis, it is about 4% during the first 5 years, 10% 15 years, and 18% at 20 years. So if you notice any changes in the skin, any enlarged lymph nodes, salivary gland enlargement, call your doctor immediately. As a rheumatologist, I educate my patients extensively about these changes, and I follow up with them with labs regularly. You should watch my video about neurological complaints in Sjögren's disease, as this is very commonly misdiagnosed and mistreated. Now remember, these videos are just for educational purposes and they will not serve you for diagnosis purpose. If you have these signs, find a rheumatologist with a lot of experience in managing Sjögren's disease, someone that can understand and treat this disease properly and ask for specialized help. I hope this video will help you understand how Sjögren's disease is a complex disease. If you have any other questions, leave them in the comments below. Until next time, stay healthy, stay curious, and get informed. Thank you.
Rheumatologistoncall.com